Cigna. It's designed to meet the needs of 95% of the population. It's a new kind of plan which is called a specified benefit plan, and it utilizes one of the largest networks in the country. The first thing is when you go to the doctor, you simply show a card. You have no copay. You'll have a copay possibly later, but we'll talk about that more. The company's going to discount the bill. Then they're going to pay their specified amount toward that care. Because they know exactly what their costs are going to be, they're able to keep their premiums low. Okay, let's talk about how this plan pays. There are only two options, A and B. When you go into a hospital or you go to an outpatient surgical center, option A is going to pay $1,000 per day. Option B is going to pay $2,500 a day. Both plans will pay an additional $500 when you're in the ICU. On Plan A, your admitting doctor receives $50 a day. On Plan B, $75 a day. That's essentially the difference between the two plans because everything else now is identical on each plan. For example, if you have surgery, it will pay the surgeon 150% of the Medicare eligible charge. This will cover their contracted rate. It also pays the 20% of the surgeon's fee for an assistant surgeon, and it pays the 20% of the surgeon's fee for the anesthesiologist. When you go to the doctor, which is what normally happens with most people, they don't have surgery, you go to the doctor, it's going to pay on either plan $75 toward that office visit. We also cover wellness. You get an extra $35 towards that. You get an additional $125 in the ER for option A and another $250 for option B. Pap smears are covered, mammograms are covered, X-rays, MRIs, PET scans, CT scans. We'll even pay $150 a day for up to 30 days for home health while you're recovering from a surgery. Let's look and see how this would actually work. Let's say you had a routine physical. On a major medical plan, if you went to the doctor, he's probably going to charge $165 if you don't have insurance. Reprice, that goes down to about $110. With a major medical plan, you've probably got a copay of $40. You're going to have lab work, which typically runs about $235 to $240. It would be repriced down to about $33. Your copay would be $25. So the total repriced bill is $143. You would pay $65 of that, and you'd be done. On our hybrid plan, say the costs are exactly the same, $165 repriced to $110. The insurance company is going to pay $75 toward that visit. When it comes to the lab work, $237 repriced down to $33. This is where your wellness comes in. Company's going to pay $35. And you say, well, why would it pay $35 when the bill's $33? Because this is a specified benefit plan. What that means is it is going to pay whatever the amount allowable is, not up to a certain amount. So, in this example again, you've got a $143 repriced bill. The insurance actually pays $110. You end up paying the difference, which is about $33. That's roughly half of what you would pay in your typical major medical plan. Or what happens if you get sick? Let's say that you got the flu. Maybe you didn't go for quite a while. You might even have walking pneumonia. You go to the doctor on your major medical. His regular price is $130, repriced down to $65. That's a very accurate fee. That's what my doctor's reprice bill is. If I was on a major medical, it'd cost me about a $40 copay. Let's say I had a couple of X-rays because he was concerned I might have pneumonia. List price at $180, repriced to $110. I'd probably have a $25 copay on that. So the total reprice bill is $175, and it cost me $65 on my major medical plan. On the hybrid, Same cost, same repricing. The insurance company is going to pay $75 for the doctor visit, even though it's repriced to $65. Again, it's because it's a specified benefit. We're going to pay all the amount. On the x-rays, repriced down to $110, the insurance company is going to actually pay $100. So the repriced bill is $175. Well, the insurance company actually paid $175. You walked away with no copay. Can you see how using this plan is probably less expensive than what you have going right now with your major medical? Let's look at a 3-day stay in the hospital. Although most people don't go in the hospital, especially small business owners, because you can't afford to be away from your business, let's say that, I don't know, your gallbladder burst, and now you've got a 3-day stay. List price for people who don't have insurance, as you look down the various costs, would probably come close to about $31,000 for that hospital stay. The repriced or contracted rate brings it down to $11,850. If you have a typical major medical with a $5,000 deductible, you're going to pay the first $5,000 of that $11,850, and then you're going to pay 20% of the remainder up to the top of the repriced bill, which means your total out-of-pocket in this example would be about $6,500. That's on your major medical. Let's look at how you would be covered on the hybrid. On option A, which pays $1,000 a day in the hospital, they would pay $3,000 first of all because it's a 3-day stay. They're going to pay $150 to the doctor. They're going to pay the surgeon's rate, and they're going to pay the assistant surgeon and the anesthesiologist, which means